if you practice martial arts or boxing and you have foot pain, this video is perfect for you. Hi, I'm Dr. Molly with Your Goals Physical Therapy. And one of the more shocking events, at least for me, when I started boxing, was how incredibly sore my feet got. It was unreal. I remember distinctly trying to jump rope for a warm up and bouncing from one foot to the other, trying to figure out how I could possibly levitate, because just the impact of that was causing like sharp pains. And of course, everybody else is doing it, so you don't want to be the only person that has to like stop and stretch. You want to keep going, and just the sharpness of the pain in the bottom of my feet was very shocking. And like many people that I've treated since I actually suffered from that myself, it's not just that it bothers you while you're training. It carries over while you're at home, right? You have pain when you get up in the morning. You have pain if you sit too long at your desk. But really, let's just be honest, you might be able to suffer through some of that at work and at home, but when you're trying to work out and you're trying to get this good burn and try to do all these healthy things for yourself, and your coach is yelling at you because you can't stay in the pivot stance where you're up on the ball of your foot because it hurts too much, so you keep waiting for them not to be looking at you so you can put your foot down, or you're losing power and you can tell that you're losing power in your punches or your kicks because you're not able to be in the right position to be able to do the punch or the kick correctly, because again, your feet hurt and it's really hard to concentrate on everything else that you're trying to do when your feet hurt. So let's talk about what it is that's causing your feet to hurt and why maybe it kicked up, because if you've never had foot pain before, why would it be all of a sudden now happening to you? And then of course, let's talk about how we stop it from continuing, because that's the ultimate goal. The ultimate goal is to get back and get everything out of my workout that I want, to be able to train as hard and as frequently as I want to without having to worry about my feet hurting. So let's talk about this. So typically what is causing problems on the bottom of our feet is called plantar fasciitis. It gets that name because there's a fascia on the bottom of your foot. It goes from your heel to the ball of your foot. So it's basically the whole underside of your foot. And there's this thick, it's kind of like a ligament, but it's considered fascia. It's a very stiff tissue that helps you get arch support, or to have arch support. But when it's irritated and inflamed, it causes a lot of pain. And what causes that irritation is it being overstretched, or the muscles on the bottom of your feet feeling like they're being overworked. So there can be kind of a combination thereof. But ultimately, the bottom of your foot has been stretched past its normal capacity, and it's asked to do a whole lot of work, and it just causes an overuse injury. So now, why would it be? Because there are some people who come into martial arts and boxing, and they were runners and they were athletic beforehand. They did all these other things. So why would it be martial arts or boxing that suddenly causes all this foot pain? Typically, when you do any other sport, you do it in a pair of shoes. And if you're a runner, you know that there's lots of supportive shoes out there that people use. And so when you go into martial arts or boxing, a lot of times the shoes are either very thin soled, almost like you're not wearing any support at all, or you're barefoot. And that means that the bottom of your foot has to do a whole lot more work than it's typically used to, because just like your hand, in fact, your foot and your hand have the same amount of muscles. So, and you have a whole lot of movement that's available that helps you balance. It helps you have power when you're landing and when you're kicking, so that your feet actually have quite a bit of musculature that we just don't think of every day. And so when we are barefooted, those muscles do a whole lot more work than if they're inside of a shoe that is enclosed, so it's getting compression, and the bottom of it, especially if you're in a hard-soled shoe all the time, then the bottom of your foot doesn't have to do a whole lot of work because the shoe's doing it for it. So once you go barefoot, it's a different subject. So now, how do we stop this, right? How do we make it to where jumping isn't so painful, standing in our good fight stances and on the ball of our foot? How do we get back to where that isn't so painful? So here are a couple tips. One, after, especially if you start noticing this happening at all, immediately start to ice the bottom of your foot. I know that seems weird and nobody likes cold feet, but I promise if you ice for about 10 minutes, you'll notice that there's less discomfort. There are several ways that you can ice. You can either just let your foot literally rest on a flat ice pack. You could also freeze a water bottle and roll the bottom of your foot. Now, if you choose the rolling the bottom of your foot, don't be aggressive. It's already overstretched, so if you're digging that water bottle into the bottom of your foot, thinking that's going to make it feel better, you could just be irritating the tissue a little bit more. So just ice. If you're going to roll your foot, just be gentle with it. The idea of like a gentle stretch. The other thing is stretch your calves. I know that seems silly, but with all that jumping and bouncing around, your calves actually get a huge workout. And so if your calf is tight, it just adds extra stress to the bottom of your foot. So there's you want to stretch the front of your front of your shin and the back of your back of your lower leg, so your calf. You want to get both because it's going to help out the bottom of your foot a whole lot. Don't just do the back and don't just do the front. You want to stretch both sides of that lower part of your leg. Now, some people have found that they like the ankle braces. So you'll see them, they go from like the ball of your foot all the way up just over your ankle. And a lot of people even train with those, they fight with those. Those are great. With the benefit to wearing one of those is that if you just need a little bit extra support, then and that takes off the irritation, that's what the brace is going to do. Because essentially by compressing your foot with that brace, it's taking over some of the work that your foot muscles would have to do or your ankle muscles would have to do. So all those bones that those muscles are trying to stabilize, we get stable from the brace. And for some people, that takes away everything and everything's all good. They train just fine with those. Some people, they need a little bit extra past what that support will do. And so you can buy one and see if it helps, by all means, because it certainly can help. It helps a lot of people. And then the sad thing is if it gets really bad, you may need to take like a day or two off. Now, I say that sparingly because I'm not one to take off of any kind of athletic sport. Like I think everybody should be more active, not less. But let's say that you went gung-ho and you did a whole lot of training super fast and your feet are just on fire all the time. See what happens if you take 1 or 2 days off and then you go back. Because if that disrupted the whole pattern, just like with the brace, if that disrupted the pattern of being uncomfortable and you can go back and train the way you wanted to, you might have just overtrained a little bit and you just needed to break. But what happens if icing doesn't help? What happens if putting a brace on doesn't help? What happens if stretching's not doing anything? And what happens if you took off way more than just 2 days and this pain is not going away? Do you have to just give up boxing or martial arts or this activity that you've grown to love? No. That is what movement specialists are for, right? So this is what I do all day. I did it for myself to try to help figure out why my feet were taking on so much stress. And I've helped many, many other people overcome pain in the bottom of their feet, whether that's martial artists or people who wanted to get up and be able to jump and their feet just would not tolerate that. There are so many things that are going on when your foot hits the ground that can be adding extra stress to the bottom of your feet. And like I said, there are a lot of muscles in the bottom of your foot. So if any one of those is being stressed out or not utilized properly, there can just be a lot of reasons why you're having so much discomfort. And so the other thing that I get asked is, why would I go to a movement specialist and not a doctor and go get maybe like a cortisone shot, or do I have to have surgery? So there are a lot of differences. So what a cortisone shot does is very similar to what ice does. So cortisone is a high-powered anti-inflammatory. And with an anti-inflammatory like cortisone, they literally inject it into the bottom of your feet and it helps get rid of the inflammation. And that is, well, obviously you're not injecting ice into the bottom of your foot, but the ice, it should be a very good anti-inflammatory. So if the ice isn't helping you, then I'm not sure that the cortisone shot's going to do you as the same kind of thing. Not because cortisone's not stronger, but if it was only inflammation, then the ice should have at least made you feel a whole lot better. And so that becomes the thing, is that people will go get a cortisone shot, and maybe for a day or two they feel a little bit better, but they go back to their sport and whatever caused the irritation to begin with is still there, and so the inflammation comes back. So if you need the cortisone shot just to be able to walk and make it through your life, I completely understand that. Everybody needs to be able to live and have, be comfortable and be able to move around and be free of that. But that may not be the only solution. That may not be like the end of your treatment to get you where you want to go. So I just want to preface that. It can definitely be a tool to get you where you want to go, but if the ice isn't really helping do what you want, then the cortisone shot's probably not going to be the cure that you're hoping for. So what is a movement specialist going to do for you? So I look at your foot, and a lot of things in your foot. So how everything's moving. How's your ankle moving? What's going on at your knee? What's going on at your hip? How does that all balance in? Maybe there's something going on the other side, because you'd be surprised how many people come in with a right foot pain and they tell me that they had something going on they had an old injury on the left side. And how is that affecting how you're landing and how you're moving? So I look at you as a whole person and try to figure out what's happening for you to stress out your either one foot or both your feet while you're doing this. And it could be very simple, right? It could just be that it was overused. You're new to this wonderful sport, and jumping and pivoting and all these things, trying to kick and punch, they just stressed everything out. But it could, if the icing and the stretching is not really doing anything for you, there could be a little bit more complex things going on. So if you are trying to get back into your boxing or your martial arts and your feet are kind of hindering your progress here, and this is the type of care that you're looking for, simply reach out to me with one of the links below. And I hope to talk to you soon. Bye.